As fentanyl continues to cause death and despair in our communities, it seems to hit our young people the hardest.
The state health department says in 2019, of the 222 fatal opioid overdoses in Colorado, 36 were people 15 to 24 years old. In 2020, that jumped to 540 overall deaths and 109 people in that age group. And while the new data isn't out just yet, health experts say the number of deaths jumped again last year. Our Karen Morfitt taking a closer look at this health crisis tonight. And Karen, you talked with a teenager who is fighting the battle and trying to save others.
Absolutely, Jim. And he is back in class here at 5280 High School. He says, unfortunately, he still hears from teenagers who look at fentanyl as some sort of party drug. He has seen the reality of this drug, and he is hoping by sharing his story that he can help save lives.
It's different perspectives of
Today, 16-year-old Keegan Pyron is in class working alongside his peers. But just a few months ago, he was clinging to what little of life he had left.
fentanyl and meth. That's all I stuck to, and eventually the places I went to stopped selling meth because they were all just selling fentanyl.
But his addiction didn't start there. He says it grew from marijuana to experimenting with pills.
I started buying more things off the street. And that kind of grew into its own separate thing.
His first exposure to fentanyl through another drug.
And that I liked it more than I was doing. I'm going to go to that same guy because I knew he was going to give me this, and I liked it.
The fear of dying, not as powerful as the urge to get high.
All the worry just vanished, all the concern I had, all the people that were telling me that it would kill me. It was just, I don't care about that anymore.
It was an overdose that pushed him to find help and led him to 5280 High School for teens in recovery.
Kids may be looking for cocaine. They may be looking for meth, maybe they're looking for heroin, maybe they're looking for marijuana, but fentanyl is everywhere.
Keith Hayes is the director of recovery for the school. He says the drug took one of their students last fall.
We were trying to get her into treatment, but she had Medicaid, and because of her social economic situation, there's very few Medicaid beds in the community.
With fentanyl, he says your next high could be your last.
I would love to be able to have resources available to be able to get kids the proper treatment that they need when they need it.
That loss was a wake-up call for Pyron.
The effect it had on such a large amount of people, it broke my heart, and I didn't want to be that person.
Now, 5 months sober, he has his grades back on track, is looking at colleges, advocating for change in Colorado law, and sharing his story with one hope.
I want to share my experience so other people don't have to live it, and that if they are living it, to know that it does get better. Hayes and other advocates say they are reaching out to politicians, city leaders, anyone who will listen about the lack of treatment options. He says that is an issue that needs to be addressed as soon as possible. In Denver, Karen Morfitt covering Colorado First.
Karen, so important to talk about this and make some changes. Thank you.